Hello, friends. If you had a chance to attend the most recent Wednesday live stream I did, which was the types of medical and health writing workshop, you are familiar with the 8 or 9 different types of health and medical writing that are available to you to pursue as a healthcare professional, healthcare provider. What I want to talk about today is for those of you who looked at that spectrum of 8 different types of medical and health writing and narrowed down based on the checklist that you completed, narrowed down that health content writing was the specific type of medical and health writing that you would be interested in pursuing, then this conversation is for you. And this conversation answers a question that many pharmacists who are interested in pursuing freelance health content writing have after they learn more about what it is. The question is, how can I choose a niche to specialize in as a freelance health content writer? So, we're going to answer that question today. Before we dive in too deep, though, I am going to backtrack a little bit to help make sure you are differentiating appropriately between type of medical and health writing and niche, because those are two different terms and they mean and refer to different things. And I've heard some people using them interchangeably. So I want to clear that up. That's what we're going to do in a second. First, I'll introduce myself. If we haven't had the opportunity to meet yet, my name is Megan Freeland. I am a public health pharmacist turned health content strategist. I've been working as a health content strategist since 2016, 2017 with my company, Stock Rose Creative. And I also run the Health Professionals to Health Writers program. Through that program, I teach pharmacists and licensed healthcare providers how to replace a portion of their primary income through freelance health content writing. So that is why whenever you hear me talk about medical writing, like we did in this past workshop, I will always hyperemphasize that although I have worked in 4 to 5 different types of medical and health writing across my career, my current specialty and the specialty of the Health Professionals to Health Writers program is health content writing. So if you have interest in regulatory writing, med info, medical communications, etc., that is not my wheelhouse. My wheelhouse is health content writing. So that's what we're going to talk about today. Now, it's important to understand what a niche is. If you already are wondering like what your niche could be as a health content writer, there's a chance that you have an understanding about what that means. But for those of you who are more recently learning about health content writing as an option, the word niche might not even be familiar to you. So a niche is basically a specialty area. And in the context of freelance health content writing, it is your writing specialty area. Basically, it's like a little lane that you carve out for yourself that you become known for as a health content writer. The difference between your health content writing niche and the type of health, medical or health writing you're interested in is important. Oftentimes when people reach out to me and say, "Hey, I'm interested in medical writing, like, can you help point me in the right direction?" My first question, if you've been around, you already know what my first question is. Drop it in the comments if you already know. But my first question is, do you know what type of medical or health writing you're interested in? When I ask that question, I'm not referring to a niche. I'm not referring to your writing specialty area. I am referring to those 8 types of medical and health writing that we talked about in that workshop. So I'm asking, okay, you're interested in medical writing. Does that mean you're more interested in regulatory writing or medical information or health content writing or medical education, et cetera, et cetera? When I ask about type, I'm talking about the specific categories of medical and health writing that fall under the medical and health writing umbrella. So that's like the type of medical or health writing. But when you talk about a niche, that is, okay, you've decided on a specific type of health writing. For the sake of our conversation, we're going to say health content writing is your specific type of interest. Now, within health content writing, what is the niche or the specialty area that you want to primarily focus on or be known for? And so in a lot of cases, that niche is a therapeutic area. You could say that I want to create health content for the general public that focuses on women's health, or that focuses on sexual and reproductive health, or that focuses on oncology. You know what I'm saying? It could be a therapeutic area, but we're going to talk about that a little bit more later because it doesn't have to be a therapeutic area. There are different ways that you can niche down. Hopefully, though, that gives you an understanding of what is meant by type of medical and health writing versus health content writing niche. Two different terms. Before we dive deeper into the types of the ways that you can niche down, I want to first share a little bit about why I consider having a niche in the first place to be critically important, especially for new health content writers. The reason it's important to talk about this upfront is because there can be some resistance or hesitancy when it comes to choosing a niche. I know this because when I started my own health content writing journey, I too was resistant and hesitant to choose a niche. I felt like as pharmacists, right, we know a lot about a lot of disease states. Same thing if you're a nurse, a physician, a physical therapist, a dentist, you know a lot about a lot of different topics. And so if you are coming into health content writing with the intent of educating patients on a large scale, then it makes sense that you would want to write about as many topics as you could because you have that background, you have the ability to do that. That is the perspective that I had when I first started out as a health content writer. I felt like I was going to be the anti-niche health content writer. And I actually spoke with someone who was not a health content writer, but she was a content writer more broadly. And she took the same approach. She kind of refused to niche down and wrote about lots of different industries, lots of different topics, like even beyond healthcare, just like would write content about all kinds of industries and topics. And I looked to her as inspiration. I'm like, if she can do it, I knew it. I can do it too. Everybody who keeps talking about niching, I'm not going to listen to y'all. I'm going to just explore and figure things out and write about the health topics that I'm passionate about, maybe in different formats. I wasn't just doing content writing at the time. I was also doing some email copy, some website copy, which is more like copywriting than content writing. So I was kind of dibbling and dabbling all over the place. And I did that for probably a year and at least a year and a half, at least. And across that year and a half, I started to realize that I was getting, I wouldn't say burnt out, but exhausted and drained. And as some of you know, if you've heard my story, when I first started health content writing, I also had a full-time job. My son was like 1 year old sometime around that time. So I had a young child. I was planning a wedding. There was a lot going on. And for a semester, I was in a graduate program. And so I realized that I was pulling myself in so many different directions, like the mental energy that was required to switch from one project that was in this one particular space to this other project that was in an entirely different space to this other project that again was in an entirely different space. The mental energy that it was starting to take to switch between projects as I started working on more and more projects was too much. It was not sustainable. My brain could not. I don't know if it was like part pregnancy / new mom brain, plus working mom brain. I mean, there was a lot going on in my life at the time, but through going through that experience, I started to understand that it is not that you can't make money as a freelance health content writer if you don't choose a niche. Like you can, there's plenty of projects that you can be a part of, but understanding that there are costs that you are paying for that. And for me, the cost was in the mental energy that it took for me to be able to switch between projects. And I was starting to get to a point where I didn't have the mental energy to be able to do that. And so if my goal was to scale and to increase my business, my clientele, my income at that time, which that was my goal because I was actively planning to move into freelancing full time. So I knew that I wanted to scale up and increase. I also knew that there was no way that I could do that sustainably if I was not more focused in the type of writing that I was doing and the type of clients that I was working with. Because all the switching back and forth between different types of writing and between different types of clients was not conducive to me being able to sustainably increase that base and increase that income. So the moral of my experience that I want you all to take away from this is you don't have to niche down, that it's not mandatory. It's not like if you don't choose a niche, you can't be a freelance self content writer. But if you are desiring to be a freelance health content writer, at least in part for income reasons, um, if you have limited time available to you, if you have limited energy to expend, then niching down is going to be your friend. That is going to be an advantage for you. Um, Other advantages that apply to anyone, niching down makes you more referable because it makes you more memorable. If I'm chatting it up with someone at a conference and they ask me, "Oh, Megan, what do you do?" and I say I help digital health companies develop content strategies in culturally relevant ways, that's going to be more memorable than if I just say I write health content for health companies. My niche was very specific, and ideally in that person's mind, by sharing my niche, they immediately can think of someone who would fit the description that I just gave. They can immediately think of a digital health company that would need a culturally relevant content strategy. That's like immediate. Whereas if I say I'm a health content writer for health companies, I mean, there's probably plenty of health company owners they know, but how do I know which one would be most appropriate? Would you be appropriate for all of them? You have to have some level of expertise. Like there's just more follow-up questions that you have. So niching down makes you more referable because it makes you more memorable. And it also helps you be perceived as more valuable because you have a more specific set of expertise. And because of that, you can demand higher rates. The way that I equate that last point is like in the healthcare world, specialists are perceived as having a more specific and in some ways more valuable set of expertise and experience because they are specialists, and they can demand higher rates because of that set of expertise in comparison to a generalist who still offers valuable services but might not be able to demand the type of rates that a specialist can demand because their skill set is less specialized and more general. So the same thing holds true when it comes to niching down. If you have any questions so far, be sure that you're dropping them in the comments, and I'll be able to answer them or to get back to them in the comments if I don't answer out loud. I want to move on and talk about how you actually do it. Okay, so now that you're convinced that niching down is something that is important for you to do, especially as a new health content writer. And I should add that in health professionals to health writers, I know I just said like you don't have to niche down, but it's a really good idea too, and I highly recommend it. In health professionals to health writers, the students are going to niche down. It is mandatory as a part of the program because when they move on into their portfolio phase, that they need to have their niche so that they're creating a portfolio that's as specific as possible. So that was just a general comment that if you are a new writer and you don't want a niche, technically you don't have to. But if you're a new writer and you are enrolled in health professionals to health writers, you are going to choose a niche in phase 2. But you are not going to have to do that on your own. One of the things that I start by teaching students in that phase is about the different types of ways that you can niche down. Now, I mentioned earlier, oftentimes a person will niche according to a therapeutic area. I gave the examples of women's health, sexual and reproductive health, oncology. You get the point. That is one way that you can niche down, and I would say it's one of the more common ways, but it's not the only way. You can also niche down based on the types of people that you are going to be creating the content for. Maybe there are certain characteristics of that audience that resonate with you and that make you want to create educational health content for them. Or maybe it's that you want to work with a certain type of client. So if you want to only contract with certain types of clients, then you might niche down based on characteristics of the company or of the client. So an example of that would be when I first started out. Again, I didn't have a niche, but eventually, when I started trying to choose one of the first niches I chose was working with independent pharmacy owners. So that's an example of how you would choose a niche based on the type of client that you would want to work with. I didn't niche down based on what I was writing per se, but I niched down based on the types of clients that I wanted to support through my writing. So that's one way. And then another way to niche down is by the format of the content that you're writing. So for me, I focus on blogs, but again, I used to do emails and website copy as well. So those are also different types of content formats. In health professionals to health writers, students are only focusing on blog content formats. So that is like another way that we're niching down in that program. But there are also other content formats that you could pursue in your freelance health content writing journey. A not disclaimer on that, but just some extra context on that. And pro tip: if you're a new writer, I would recommend sticking to a single content format. Blogs would be a great one for a new writer. And that's because different content formats involve different skill sets. So copywriting involves a different skill set than content writing does, than blog content writing does. So it's not to say that you can't consider doing other content formats as a part of your business if that's something that you want to do in the future. But I recommend focusing on one upfront because of what we just talked about, right? When I was doing blogs and websites and emails and probably like social media or something, that's all pulling your mind in different directions because you have to approach each of those different types of writing very differently. And if you're a new writer, that means that you really don't have much of any writing experience. And so that's definitely not a place where you want to be trying to pull yourself in a lot of different directions. So again, content format is a way to niche down, and I recommend niching down based on blog content writing for new writers. So those are a couple of the ways that are available for you to niche down. And so going back to the question of, all right, well, how do I choose a niche, right? You now are aware of the different, why niching down is important, how you can niche down and like specific ways that you can do that. But then how do you actually choose which niche is going to be your niche? This can be challenging because there's like a certain side of people who are like, well, you need to niche down based on what you're interested in and what you're passionate about. Just choose a niche that you're passionate about. And then there's another end of that spectrum where the advice is you need to like forget about your passion. Don't worry about that. That's not important. You need to niche down based on whatever makes the most business sense, whatever makes the most financial sense. I'm a Libra. My birthday is actually today, October 7th, because I don't know when you're going to actually see this, but so I'm in the middle, right? I see where both of those perspectives are coming into play. My perspective is that both are important. Both can be true, both are true, and both are important. And so I think that it's important for writers to take both of those things into account and more. There are other elements that also need to be taken into account when you are choosing a health writing niche. In the program that I run, students kind of choose their top niche options, and then they use what I call the 4P checklist that they can use to evaluate each of those options. So a part of that criteria is like interest in like personal interest and passion. And another part of that criteria is the financial side and the business side. And then there are other elements that are part of that checklist as well. And they can use that to kind of line up all their niche ideas side by side, compare, contrast, and see which one would make the most sense for them. for you, for anyone who's not in the program, what I would recommend is thinking about what personally interests you and then what you perceive to be a good business decision. Are there companies that if you chose this niche, they would exist for you to be able to write for them? Like if you said that your niche was going to be um, rare diseases that affect um, I don't know, people in the Pacific Northwest. That is hyper specific. How many companies can you think of that would need you to write in that niche? How many companies can you name that if you told them, I specialize in rare diseases in the Pacific Northwest, that they would actually need you to write for them? That is the question you want to ask yourself to determine whether there is a market for the niche that you have chosen. There is such thing as over niching. So you don't want to get so specific that there are no options left in the pool of clients to write for. But you do want to be specific enough that people understand where your specialty area is. So if you are interested in learning more about health professionals to health writers, not only the process that involves niching down and helping you choose that niche, but the other parts of the program as well, you can feel free to comment right, and I will shoot you a message with details for applying. The cohort is halfway full as of now, and so there are a few more spots left. Um, I personally wish that someone would have given me the tough love that I needed in the beginning of my journey, because that 1.5 to 2 years that I spent just doing all the things, I could have been using that time to build my business in a more targeted direction without all of the stress and the tiredness and the exhaustion from bouncing around to all of these different projects. So hopefully this video alone has been helpful for you in helping you maybe reframe how you think about having a niche and the value of a niche, and then also giving you some ideas about how you can start to evaluate and consider what your niche options would be. For those who are interested in the program, as I tell students during our next steps calls all the time, people come into the program on a spectrum in terms of where they are with their niche. Some students come in and they're like, I already know what I want to write about. Like it's my professional background. Like this is what I want to write about. And some are like, I have no idea. How am I going to figure out what my niche is? All of them go through the same process that helps them brainstorm valid niche options and evaluate them according to that 4P checklist. So just know that it's not something that you have to do alone. And that if you need that tough love, you will get that in the Health Professionals to Health Writers program, because it's something that I wish that I would have had somebody to just be like, yes, Megan, you can do a lot of things, you can write about a lot of things, but if your goal is X, then this is going to be a more sustainable and more productive approach for you. So if your goal is to really scale up the income that you're bringing in as a freelance health content writer, you got to put on more of a business lens, and not take it so personally, so that you can reach that goal. So take that with a grain of salt or more, if helpful, and apply it to your life and to your journey how you will. And for anyone who is interested in applying for the program, I'll be sure to shoot you a message.